Understanding Gestational Diabetes with Dr. Preeti Nanda Sibal. Welcome guys, and today I'm going to dive with you on this very important topic that affects many expectant mothers, gestational diabetes. Now what is gestational diabetes? Gestational diabetes is a type of diabetes that develops during pregnancy. In fact, it is that triggering point which tells a woman whether she will become a diabetic between 30s and 40s of her life or not.
It is so frustrating that I could possibly have diabetes. I think this is just a wake-up call that, things just might not be going the way that I thought they were, and that I just need to try to be healthy. She said she would just try to add more protein into my diet.
Ugh, that freaks me out.
I know, just the anxiety now that I have until I deliver. And then otherwise, she said my baby is at like the 95th percentile of height. I'm like, are you sure that's my kid?
Wait, can I ask you a question?
It happens when your body can't produce enough insulin, the hormone that regulates sugar. Now this can lead to higher than normal blood sugar levels, which affects both you and your baby. In fact, around 24 weeks, glucose tolerance test is conducted as a ritual today because around that time, most of the mothers who will have gestational diabetes are diagnosed with this. Though it's very common and usually manageable, gestational diabetes is something we must take seriously, as I already told you, because it is an early indicator that you will become a diabetic sometime later in your life if you don't care about it now. It can of course increase the risk of complications of the child, and you are a candidate for type 2 diabetes. So let's see, why does this happen? Certain factors can increase your risk of gestational diabetes. These includes being overweight, having a family history of diabetes, being over 25 years old, having insulin resistance even when you became pregnant, or having had gestational diabetes in the previous pregnancy. However, it is important to note that even if you do not have these risk factors, you can get gestational diabetes. So regular checkups are crucial, essential, and therefore our loving gynecs have now made it a part of their protocol. How can you manage diabetes? Eating healthy and staying active, of course, those are the basic rules. But on top of that, what more you can do? Plenty of fruits, vegetables, whole grains and lean proteins in your diet are a must. A caution here, when I say plenty of fruits, never take fruits on their own. Add them to chia seeds, add them to salad, take them as a mid-meal, go for walking after that. Why? Because fruits are rich in fructose, and that is only cleansed through liver. And because of the toxic environment we live in, our livers are completely clogged. So be careful. This is my word of caution. Regular checking your blood sugar levels are very important, and getting yourself checked is important. After giving birth, gestational diabetes generally goes away, but you must continue monitoring your health so that you don't land up to become a type 2 diabetic. Stay active, eat well, maintain a healthy weight, and never become a diabetic in your life. I am with you always, Dr. Preeti Nanda Sibal. Thank you.